Hi everyone, Gabriel here for Smart Fitness. Today we're going to go over some strategies that might be helpful for you if you're dealing with back pain. Back pain can happen for many different reasons. In this case, we'll look at back pain that might occur as a result of excessive flexion, maybe as a result of sitting down too much, or if you're a big runner or a biker, or maybe you like to do a lot of squats. So those tend to create a lot of flexion, and if maybe done too much or if not balanced correctly, that can contribute to lower back pain. With that out of the way, let's get started. Okay, so when it comes to working with pain, usually the first thing you want to look at are which muscles are weak and not firing or working right, and then which muscles are not shutting off, they're too tight or they're hyperactive. So in this video, we'll look at some strategies that we can use to be able to identify which muscles are hyperactive, not shutting off, and have some strategies to try to address those. So we'll go over a few different stretches. Usually this is a Bretzel series I like to explore. So we have our first Bretzel stretch here, grabbing this back leg. If we can, we'll grab the ankle. If you can't, you can grab the foot, but ideally grab the ankle would be the best. We'll take the opposite hand, we'll put it right on our thigh here at the knee. We'll drop this back shoulder towards the ground as best as we can, and then we'll look the other way. So from here, we're looking to feel something through the quad, up through the front of the hip. We can also maybe feel a stretch through the trunk as we get extension through the spine. So that'll be our first Bretzel. The next one will be our second one. We'll have our hand right next to our hip. We'll have the other hand coming right under because we don't want to end up leaning on this arm. So from here, we're just going to push. In this case, I'm pushing with my left arm, pushing away, thinking about either falling towards my knee. I'm keeping my spine straight. I don't want to collapse into it. I keep my spine straight. We're looking for some sort of stretch right through this side hip or side butt area. And then the last Bretzel stretch will be coming down here on our forearms. And then I'm going to reach across here as I keep my chest down. So I'm keeping my chest down here, reaching. And yes, we can feel something through that hip, but I definitely want to feel something through this side if it's tight. Of course, we'll do both sides. We'll see how both sides feel. You can hold all those stretches for about anywhere from 4 to 6 breaths. Again, just trying to relax through them. So for our last stretch, this will be the hip flexor stretch. If you want to make it more intense, you can put your back foot on a box, and then I'll make it more intense with the quad and the hip flexor. In this case, we're trying to see how the hip flexor feels and whether or not it might be contributing to the lower back. So you can have your hands here on your hips, facing forward. You can squeeze your butt to see if that gives you more of a deeper stretch. And then we can also reach up to the ceiling and see if that comes up through the stomach. If that feels pretty good, you can also, as you're still squeezing your butt or driving your hip forward, you can turn and see if that also gets into that psoas muscle or coming up to that abdominal area. So those are our stretches that we can explore to try to get muscles to relax. We can also look at those stretches as a way to train mobility and range of motion. So after we get muscles to work properly, we would expect range of motion to improve. So we can get those to work properly after getting certain muscles to relax, or we can get them to work properly after getting certain muscles to actually engage and turn on. Moving on to soft tissue work, we can use either balls. Another popular thing would be the foam roller. If we only have the foam roller, we can still do everything with the foam roller for now. So we can look at a few things. We have muscles that come into the front of our body, or that start in the front of our body and go into the back and connect into the back. A popular one would be this muscle called the psoas. So we can take the roller here, we can take the edge of this roller and put it right on our stomach. So you can find a good starting line would be find your belly button, put it to the left or to the right, and then you can roll up through there and see if anything is tight. It's usually much easier to do this with the ball, but again, if you don't have it, then you can use your foam roller as well. So here, I'm on the ball. I'm on the right side of my belly button, just rolling that out. I can get all the way through the hip and right below my rib cage. The next thing we can do is just shift more outside. So the QL in this, it would be a muscle more on the outside. Again, that can, if it's upset, that can contribute to back pain. So from here, I can just roll over more towards my side and see if anything is sore or tender there. And you can think of this as just a way to massage your abdominal muscles that connect to your back, and if they're upset, they'll yank on your lower back. You can get all this through the front, through your lower pelvic floor area, and again, that's just kind of coming more that lower abdominal area. So we're looking at sections. This is my belly button. We're coming to the side here through the psoas. We have the lower pelvic floor coming through here more, and then we have the QL coming through here. We can use the roller to look at the quads. So the quads are going to connect right up through the hip. So we can do both sides here evenly. If that's pretty easy, then we can go one side at a time and just kind of get right up through there. So if the quads are tight, that could also pull the hip in an anterior position, creating back pain. And then lastly, we can use the roller to get extension in our spine. So you can put this on the back. We can support our head here, drop the head, and just get a good stretch to the back. That feels good. You can roll up and down a little bit. So it's not a big movement here. We can also drop the knees to the left and to the right. And again, we're just trying to get a good stretch through the upper part of our back. And that's going to be some soft tissue work that you can do to help address any type of low back pain that you're feeling. In this case, low back pain that may be created through excessive flexion. So those are going to be some strategies that you can use to help identify some issues that may be contributing to your lower back pain. Again, of course, there are a lot of different reasons why lower back pain can happen. So I hope that some of these strategies help you. The big thing, again, when it comes to dealing with pain is usually figuring out how to identify muscles that are weak and not working, and then how to identify muscles that are hyperactive and not shutting off. But again, if you have any other questions, you can always reach out, and I'll be happy to answer them.